A warm welcome to our expert today, Henning Glaser, and our audience worldwide. My name is Stefan Burkert, and I'm the head of the division South-Southeast Asia, and I will be your host today. The HSF as a political foundation has been involved in international cooperation for more than 40 years now. We are active in more than 50 countries worldwide, and we do contribute to sustainable development by enhancing peace, democracy, the rule of law, and social market economies. Together with local partners, we implement projects in the area of political consulting and political education. As you can imagine, a pandemic on a global scale like COVID-19 did affect our work. So we have to talk about it, especially about the consequences for democracy and development in the different countries. Thailand reported the first case outside of China in January 2020. The pandemic dictates our daily life now for more than 18 months. Our guest today has said that the longer the world is struggling with COVID-19, the more it proves the complexity and dynamism that evades any final and clear-cut assessment. Well, we will have a look back. How did it start? How did it evolve? And what have been the reactions by the administration and the public? We will nevertheless try to assess the dynamics in Thailand right now. And of course, we will have a look into the future. And we will speak about possible consequences from a political, economic, and social perspective. The interesting fact about Thailand is, if we would have this conversation in 2020, everybody would say, well, look at Thailand and you know how to manage a pandemic. Now in July 2021, Thailand ranked third to last worldwide on COVID-19 handling. So what happened? Henning Glaser is the founding director of the German Southeast Asian Center of Excellence for Public Policy and Good Governance, CPG, which is headquartered in Bangkok. He teaches at the Faculty of Law at the Thammasat University. His research areas cover, among others, comparative public law and politics, constitutional law, global governance, and geopolitics. He regularly serves as a consultant to governmental and non-governmental agencies in Europe, Asia, and America. Some technical information beforehand. Please feel free to ask your questions related to the pandemic in Thailand and the Thailand handling of it through our Q&A box. Make the questions short and crisp. We will answer as many questions as possible in this 1 hour. The discussion is live on Facebook and will be recorded, but no worries, except of the expert and myself, you won't be a part of the recording. Well, no name, no picture. You will have the possibility to re-watch it again on our webpage. So this all said, thanks for your attendance, and Mr. Glaser, the word is yours.
Thank you very much. I am very happy to be invited here to this interesting series. And I welcome everyone in Germany and in Europe in general, and in Thailand and Asia. This series is a little bit for us in Thailand an interesting endeavor, as we did together with the Untitled Foundation study on the effects of COVID-19 on the Thai society at large. And this will be the background also of my presentation today. So I will talk here about basically two things. First of all, I will address the development and the success and failure of the COVID-19 situation. So there is a success story, as we had heard, as well as a story of some mistakes. Secondly, I will talk about the consequences of the COVID-19 situation for Thailand, for the social, for the economic, and the political system. And I will ask about the lessons that might be learned and the outlooks for Thailand. Given that, I start now to have a brief look on the development of the spread of the disease in Thailand. So Thailand was quite early affected. Thailand was, in fact, the first country out of China dealing with COVID-19 in January already. And in March 2020, a state of emergency has been declared in Thailand. That was the first wave of the pandemic, and this first wave was rather low. It was not a very pressing situation. Still, the government responded quickly, resolutely, and imposed a state of emergency. That was done in March, and it lasted until quite a time. But from May 2020 to September 2020, the situation was very positive. It developed very, very positive in Thailand with 0 domestic cases. So Thailand was really considered a big success, one of the most successful countries in handling the pandemic. That started to change at the end of the year, slowly in November and December 2020, when first cases peaked in Thailand at certain places, and a second wave surged at the end of the year, with a peak of that second wave at the end of 2020. Still, the cases were quite low. Transmissions were mainly located in local clusters. So still, in the end of 2020, Thailand could claim a success story in containing the pandemic. That started to change in 2021, this year, especially in April. In April, a third wave emerged in Thailand, and that third wave was far more serious than everything what happened before, and it's still going on. So this is roughly the development of the pandemic. So we have 3 waves, one early in 2020, a second one late in 2020, and a third one in April, starting in April this year, going on until now. This third wave is very serious because it is coinciding with the dominance of the Delta variant, which is, as we all know, quite dangerous. So this is what we see right now. We have right now around 9,000 recorded cases every day, confirmed cases, and this is for Thailand very serious. Let me have a brief look now on the way how this situation has been handled in 2020 and in this year. So 2020 was, as we heard already, a big success. Early awareness, fast response, and a very immediate and complete almost compliance of the population were the backbone, I think, of the success in handling the COVID-19 situation last year. Thailand had a very promising strategy, a very successful strategy, I think, in having at the one sense a central organization dealing with the pandemic, while also outreaching with a basic community health volunteer scheme to the local level. So that worked very well. What also worked well, contributed to the success last year, was probably that Thailand is what we would call a distance culture, a culture in which people don't come too close to each other physically. So you can see that already with the greeting in Thailand, the vai, where you don't touch each other. People speak very often with a rather low voice. So there is not so much body contact regularly in Thailand. It might have played a role. People were also used to wear face masks in Thailand because of the very high level of air pollution and so on. So they were positive contributing factors, but I think we can fairly say that lastly, it was a quite well-designed response by the Thai health authorities and the Thai government in tackling the crisis. So the question is, what went wrong in this year? We might say that a lot of decisions and a lot of factors are not easily to be qualified as mistakes or failures, but I think some mistakes are standing out, having been made this year. First of all, the government decided when the third wave emerged in April this year, not to shut down the country before the New Year holiday. That was, I think, a grave mistake, because in April, there's a kind of very important holiday in Thailand related to the Thai New Year's Eve. And that holiday is always leading to many people spreading through the country, going back to the provinces from Bangkok and so on. So this decision not to shut down the country probably contributed to the third wave. Other things I would point out as slight or grave mistakes. First of all is testing. I think testing in Thailand was conducted not perfectly well. And testing is the only way for us to see how the pandemic is developing. That's the only way to get an accurate picture of what's going on and what is the trajectory of the spreading of the disease. Testing in Thailand, I think, is not easily available. It is not being made an entry condition. If you wanted to enter certain buildings, you didn't have to provide a test. Testing is also rather following up when a cluster is emerging, or that was at least for a long time the case, and not done in advance to get representative data. And I also had the impression that sometimes when cases were found, testing was rather conducted in poorer neighborhoods and not in upscale neighborhoods, even if cases happened there. Way more important is the vaccination program. I think that is the biggest single mistake that has been done this year. So the Thai vaccination program is arguably a failure. Very early this year and already last year, I think the first mistakes were done when the government decided, first of all, not to buy, today we know, way more efficient vaccines, and when the government decided not to join the COVAX scheme of the WHO. So this was the start of the, I think, flawed vaccination program. More important, the vaccination program was too late. It provided too little doses of vaccination to the population. And as I already indicated, it was focusing on the wrong product, arguably on the Chinese vaccine, which proves today not very efficient against the Delta variant, which is dominating Bangkok. So the vaccination program is probably the turning point why the third wave is reaching that scale it is reaching right now, and why we will not be able to expect Thailand going back to normal very soon. Another thing which was coming up during the third wave is the fact that Bangkok was running out of hospital beds and ICU beds. And I think we could see here a kind of weakness of preparedness. It would have been possible earlier to prepare for this surge of cases, and that didn't happen too. So I think we can sum up the failures of the third wave as a lack of awareness, preparedness, and adaptability. What were the consequences? The economy suffered badly already in 2020, and it suffered even more this year. We have disrupted supply chains. We have shortage of labor. We have a sealing off of the country. That was a cornerstone of the strategy already in 2020 that affected tourism and affects tourism very much. The consequences of these immediate ramifications of the COVID-19 situation were that production contracted, business closed, unemployment rised, households were much indebted, are reaching now the point where they can't find anything else to finance themselves. We have non-performing loans, and we have a declining consumption. So this points to a very important point that not only single industries are affected, like tourism, but that we have a situation in which arguably the entire economy is affected, and in which we will face probably ripple effects that might be way more dangerous than everything we could see last year for the economy. We have this in a situation in which tax collection is going back, in which capital is flowing out of Thailand, and in which Thailand is facing a crisis of liquidity. So not only private households are looking for liquidity, also banks, and also the government. And this is accumulating to a dangerous degree right now in the assessment of some economists. The effects on the social system were very serious as well. So we had great effects on the social system in terms of first of all, the effects of social distancing. So social distancing measures had two different effects. One effect was that many people were now withdrawing to the private sphere and living under more crowded conditions with high levels of stress. And on the other hand, many other people were driven back to isolation and loneliness, and they suffered of that seriously. The second social effect is rising resignation and anxiety, fear for the future in Thailand. And I think both together is working in the direction of an increase of substance abuse, of rising crime, rising suicides, and domestic violence. Here I think we have a very interesting point to make. The COVID-19 situation is for every society a possibility to learn. And for the Thai society, I think we have to appreciate what has been revealed by the COVID-19 situation, badly revealed in terms of social challenges like inequality. Inequalities in Thailand are anyway a big problem. They have been a problem before the crisis. They have been exposed and aggravated by the COVID-19 situation. We have already, I think, a problem with isolation and loneliness in the Thai society that also has been aggravated and exposed, especially by the suicide rate. The suicide rate was already very high in Thailand, and it is right now way higher than before it has been in 2019. So we might also look at the structural level to understand how resilient the Thai society is under this stress put on it, and what could be done in the future to make the society more resilient. The problems which have been exposed and are now forming the conditions for recovery of the social system are family structures. So family structures are problematic in terms of a very high number of single households, of underage mothers, underage single mothers. So this points to certain transformations of the social system and the ability of the social system to provide belonging, to provide cohesion, and the lack of that is lastly manifesting in many social ills. Another thing I think which would be interesting to discuss is a relative lack of associations that could contribute to social cohesion and belonging in Thailand, and that are freely accessible to outsiders. So most people in Thailand are living in groups they have been in for a very long time. But if you're leaving your province and go to Bangkok, it's not so easy to become a member of a new group. And these kind of groups, freely accessible to any outsider, that is something which is relatively lacking in Thailand. In Indonesia, for example, you have religious communities. Every Muslim can join these communities, these associations. They will provide a lot of care, of shelter, of solidarity, and so on. This is just one example. Another example are clubs for sport, or chess, whatever. They are not so easily accessible in Thailand. You have to pay for that. Money is the entrance condition, or you have to be a member of that group already. So adding to that in Thailand, I think, is a slow burning crisis of orientation and belonging in general, which is also very important. Thailand is struggling since 15 years of political division, and it's not only political division. So I think we can say that it's a more fundamental crisis of shared identity, of shared orientation of the political and social community in Thailand. And this is also tested right now more than before. and that, on the other hand, will be one of the factors of resilience after the crisis. It's a negative factor. Another thing is that we have, I think, a number of disenchantments, demystifications in Thailand due to the crisis that destabilize also social trust. I will give you one example only. That is the idea of a kind of rural utopia of self-sufficient subsistence in the countryside. So many people in Thailand believed for a long time, if everything is not going well, you can go to the countryside and there you can survive. Everyone can survive anytime in Thailand because Thailand is a very rich country with a rich nature that will provide everything you need. This is a myth, as we can see right now, because many people in the countryside are living from remittances from their relatives in Bangkok or other big cities or abroad. They are not coming anymore. People in the countryside are really badly suffering. We have a lot of indebted households, and especially in the countryside, they are not very much supportive structures for people in need. So this is, I think, an erosion of the self-confidence, which is underestimated by observers. I think this is seriously affecting the identity of many people in Thailand. And there are other examples for these disenchantments. Talking about the political system, we have disenchantments too. And that is affecting not only the people in a politically divided society that are anyway opposing the government, but more and more people who have initially supported the government are right now very disillusioned. So in a situation like this, I think legitimacy of a government is mainly, in the Thai case at least, deriving from two things. One, leadership, stability, and performance. And the other, good governance as accountability, transparency, and responsiveness to the population. And in both wings, I think right now, many people feel disappointed. They feel that accountability is not very well developed, that transparency is not really given, and responsiveness is not exercised. One example, recently the government somehow blamed the public for the third outbreak of the coronavirus, and I think many people found that not very well responding to their perception of the situation. We have this as one problem, so many people who have supported the government and who are right now critical, and we have still a very, very important movement of dissent, an opposition movement, which is right now, I think, coming up, and that will form after the crisis or after the restrictions are lifted, a serious challenge in the political system. What we have here is a social political movement, especially carried by young people, that challenges somehow the hegemonic fundamental consensus, the fundamental contract, the social contract of Thailand. So this is a very serious challenge for the established system. And if this challenge will coalesce, come together with the people who basically support the social contract as it is, then this will form a very, very troubling situation. My last point is about the geopolitical consequences of the pandemic. I think this is also very interesting to ponder. We have, in geopolitical terms, a discussion since the beginning of this year about what is called vaccine diplomacy. And there has been the impression that especially China is very successful in its vaccine diplomacy. What we can see right now in Thailand, however, is that on the one hand, the government very forcefully decided to go with China and to set on the Chinese card in the vaccination program, but that this failed. And this failure is now very obvious. So 2 days ago, the government decided to not anymore use 2 shots of the Chinese vaccine, but only 1 combined with another vaccine. And I think this is admitting very much what is already clear scientifically, that this Chinese vaccine is rather inefficient against the Delta variant of the virus. So the effect is huge. The vaccine program was the backbone of the government's strategy to bring the country back on a normal track, to open the country for tourists, to enable production in factories and so on. This vaccine program failed, and it failed very much, and it is failing very much right now, thanks to the decision to go with the Chinese vaccine. So the impression in the population is, I think, reinforcing old ideas about maybe low quality products from China. And in the end, it's not a success at all that the government decided for Chinese vaccines for China, but it's rather the contrary. These are for me the most important points. And if I would sum up, I want to stress, first of all, or to repeat that Thailand was quite successful last year, that many people could live with the hard economic consequences of shutting down the country last year, that these people were very disappointed this year when this year the government was not able to continue this successful handling of the crisis, and that we have also the fact that what could be somehow counterbalanced last year economically is way more difficult to be counterbalanced this year. So this year it will be very difficult to somehow even meet the economic fallout, and that means also the social fallout of the crisis. As we have to look at least some months of critical situation, I would say that the socio-economic costs will rise to a very critical degree, that at the same time the political stability is eroding on different levels, on structural levels where people are disenchanted with their understanding of what it means to be Thai. In Thailand, I just want to remind of this idea of the rural utopia where every Thai can go. So this kind of safety is gone. And it is going then, this kind of disillusion, to the concrete performance of the government this year. So the problem here is performance is lacking. Good governance is not really believed by many people who have supported even the government. So this is the situation right now. And with that, I would like to invite everyone to ask or make any comments.
Thank you very much, Henning, for your words and your in-depth analysis of the impacts of the virus on the Thai society. Like it was mentioned, of course, feel free to ask questions through the Q&A box, and I will raise them to Mr. Glaser. Maybe first question from my side. You talked about the Chinese vaccine diplomacy, and you talked that actually it failed in Thailand, as it was seen that the vaccine is maybe not so efficient against the Delta variant. But nevertheless, of course, when you look worldwide, China was probably a country which could produce a lot of vaccine, where when you look at Moderna and Pfizer, they actually could just produce for the Western market. So there was at the beginning a shortage of vaccinations. Nevertheless, what do you think when you now say the Chinese vaccine program failed? What is in the long run the consequence between the relationship between China and Thailand, and especially how do people from Thailand look at China now, and will this change in the long run the relationship between Thailand and China?
Yeah, I think difficult to say, and we should not overestimate it. But what we can say, it's definitely a marketing disaster right now. So what the government will do, I don't know, and it's difficult to say if this is really affecting political relations. I would doubt that. Thailand is very good in having very flexible diplomacy, bamboo diplomacy. So Thailand is as much as a friend of Thailand as it is of the West, and especially the United States of America. So Thailand can maintain that probably very well. And I would not expect any change because of the vaccination failure in terms of politics, but in terms of the prevalent sentiment in the population. I would expect that many people in Thailand will develop a way more critical view of the Chinese performance ability in general. And that is a factor too. That is what we call it's a soft power. So Chinese soft power in Thailand is, for the time being, I mean, for now, it's weakened.
You mentioned it shortly that when you look at the sectors which were affected most by the pandemic worldwide, then of course you have to pick out the tourism sector. And if you look at Thailand, more than 20% of the GDP are coming from the tourism sector. 1 out of 6 jobs are created in the tourism sector. Now we do have the Phuket sandbox model. First, of course, how does this perform? How does the Phuket sandbox model perform? And is it a chance to revive tourism in Thailand? And what will be consequences for tourism in Thailand if the pandemic stays on?
Yeah, first of all, tourism is indeed instrumental to economic recovery with everything related to the tourism industry. It's way more than just hotel occupancy. But if you look at the hotel occupancy rate, this is revealing a lot. We had 20% last year only, and we have 10% this year. So hotel occupancy dropped even from 20 last year to 10% this year. And that is really severe, and that is very much due to the fact that domestic tourism is now not working anymore. So this is I think, the most visible manifestation of the vaccination failure. One thing. Secondly, concretely about the sandbox scheme, I can't say if it is successful or not. We have, I think, in the first 11 days, we had 5,000 arrivals. That is better than nothing. That's not so bad. We have 100,000 bookings. But we have to see how the disease will develop. It is difficult to foresee that. I think it was not easy to set up the sandbox. I think it was set up quite professional. So at least that was working. If it is now turning out to be a success or not, it's difficult to say. I can only recommend. I mean, everyone who is looking for a nice destination to do holidays, I really recommend to go to Phuket. I saw the hotels there, the prices. It's unbeatable. It's a great place to be. And I really hope for Thailand and for Phuket and also the people who go there, that many people do that. But difficult to say if it is successful or not. I'm maybe modestly pessimistic.
Okay. We look now on a sector, but when you look on a special group of citizens, we always look at the youth, actually. How did they cover or had to bear the burden concerning the coronavirus? We have seen worldwide school shutdowns, homeschooling, if it was possible or not being able to meet friends, not to play in sport clubs, and so on. How is the situation in Thailand? How was the situation in Thailand? How is it right now? And what do you think did the pandemic with the youth in Thailand? You already mentioned some factors, how the pandemic changed social behavior. but if you would have to minimize it to the youth, then what would be your assessment?
For the young people, it's most critical. People in Thailand for a very long time, young people, graduates, they could expect to find a job. This changed already before the pandemic slightly, but now it's getting dramatic. So even if you are now coming from the best universities in Thailand, which provide a quite good education, you will have difficulties to find a job. This is very serious. I mean, it reminds me a little bit of the situation in the 1970s, which was a very, very troublesome period of Thai history. And somehow I see some repetitions here, that you have a great amount of young people, of young professionals, students, graduates, not finding a job, not having any serious chance to find a good job in the foreseeable future. Very serious. Adding to that is that many of these young people are not anymore socialized so much like the generation before them. So they are already sharing different values, and you could see that very well with the youth-based opposition movement that surged last year, and that is still going on a little bit in the shadows now, but which is still there, and which is really politically significant as it dared to challenge the system in a way that never happened before in Thailand. So there we have these effects. So we will probably have a bigger problem for young people in the future. That will probably lead even to more vigorous opposition to the established system.
We have already some questions in the Q&A box, and I will come to them quite shortly. Maybe last question from my side. You talked about the health situation now arising in Thailand or in Bangkok, and especially there, the running out of ICU beds, and actually, if you have to assess the health situation in Thailand, is there a difference between the overall looming capital of Bangkok and the rural areas? And is it a limitation of equipment, so of ICU beds, of oxygen, or is it actually a shortage of healthcare personnel? And how is the situation there? I mean, if you look at Germany, it was never, or mostly not a situation of equipment, but a situation of failing healthcare personnel who could actually attend to the needs of the people who needed it.
I think it's difficult to say, but what we could see already is that the healthcare system is more shallow than believed. So it is a very developed healthcare system. Thailand provides, in some sectors, even extremely modern healthcare system, and very successful. It's also successful as a business sector. But in terms of providing public health, it is more shallow and less resilient than many believed. And I think this is another serious disenchantment for many people in Thailand who always trusted very much into the healthcare system, and who have now to see that something like ICU beds are not really generously provided. I mean, if you see that I think, if I'm not wrong, in the third wave, there have been 300 ICU beds, and a capital city of 8 million people. That's not much. The city where I'm living in Germany has maybe 300,000 inhabitants and more than, I think, 220 ICU beds regularly. So this is really a big discrepancy. And I think this is coming up now, and people see that. So this is, for me, the most important lesson related to the healthcare capacity. Moreover, another disenchantment is indeed that the provinces now have to help the capital. So doctors are coming from the provinces to the capital because the capacities there are not sufficient. But still, the healthcare system is very good in Thailand. It's, I think, a very successful part of the Thai development story. And yet, there is not enough what has been done. And I think it has to be reconsidered in the future if it is good for the public healthcare system, if a huge portion of that is dealing with cosmetic surgery and things like that, instead of really providing the necessary help to the people. And I think this is a little bit describing the problem.
Thanks for the answer. We talk now a lot about disenchantment and failure. The first question raised in the Q&A box and was quite fastly raised was that the situation now is critical due to an unpreparedness, so on the failure, and poor management of the government. So actually, what needs to be done? What are the major obstacles for Thailand to save lives and flatten the curve? So what would be your recommendations to the government of Thailand to actually solve the crisis?
I'm not competent to make recommendations, but I think the government started already to respond. So the government started to change the vaccination program. That was absolutely necessary, and that happened. And now the government is, I think, doing whatever it can to ease the situation. The question for me is not so much if the government will do the right thing related to public health. They will arguably do that now because it is really, really instrumental for the survival of the government. The more important question is, how will the government behave in terms of good governance? Will the government be more transparent? Will it be more responsive? Try to be rather intransparent and to rather blame others than to take the blame itself and do the best right now. I think this is really, really important for the future. And if I look back again to the 70s, you could observe that when the situation became economically critical in Thailand in the early 70s, for quite a time, the government back then could survive because of some degree of responsiveness. So the prime minister, the deputy prime minister at that time, they met the people, they met students to discuss with students in public. And that was, for a very authoritarian system, that time, a degree of responsiveness that I would not see right now. So right now, I see a government blaming the people instead of looking what have been the mistakes we have been made. And I think this is really important right now to see if the government will change that attitude or not.
We had in 2020, there was a movement of the 3 R's: resign, rewrite, and reform. And there were huge demonstrations in Thailand, and the pandemic stopped it, because of the situation. And the question from the audience is, did the anti-government protests create new restrictions under the fate of COVID, or were the two events uncorrelated?
Sure. There has been, as I said, the state of emergency declared in March 2020, and that state of emergency lasted way longer than the situation has been critical in Thailand in terms of health. So for sure, the health-related emergency decree very much helped to create a situation in which demonstrating was not easy and even against the law. However, there are many, many other laws you can right now field against anti-government protests, and they are fielded against them. So it's not just that, it's just a part of an arsenal of laws that can be directed against this movement. And we can see that right now. More interesting is the matter of fake news. We have quite a number of fake news cases in Thailand. So the number is, I think, rather high, of people being under criminal investigation for spreading fake news. And this is a bit problematic because when you want to have a responsive government system and a good relation between government and population, I think it is very important that people can trust that what they have to say is heard, taken serious, and responded by arguments. And if the population gets the impression that fake news laws are moved against them to somehow silence opposition, critical questioning, and so on, then we have a situation which is not even good from the perspective of the government for stability, in my personal assessment. And I think this is also a very important factor to observe for the future. How will the government deal with criticism, with being questioned? And again, the experience of the 1970s is teaching a lot about how important this decision will be. Will it listen to people? Will it justify? Will it explain? Or will it simply try to shut down criticism?
You already mentioned the fake information issue. When we look at Germany and other Western countries, we had weekly demonstrations in major cities concerning the management of the pandemic, or even the pandemic itself, which questioned if there is a pandemic. Buzzwords like Querdenker were here in Germany quite popular, or are quite popular, which are associated with conspiracy theories. Do we have such a situation in Thailand as well? So do people go on streets actually to protest that the COVID pandemic is not a pandemic at all? It's just fake news?
No. Not in that way we have it in Germany or in other European countries. But this is a very interesting point. Indeed, in 2020, it was significant that the people in Thailand were quite complying with the government, and that they were willing to accept economic hardships while complying with healthcare containment measures. This is changing, however, a little bit in 2021 right now, without, however, this kind of demonstrations really challenging the COVID-19 story. So that is what we have in Germany. In Germany, we have a lot of people saying COVID-19 is not that dangerous, or whatever it is, so it is not necessary to have any kind of serious lockdown or serious measure at all. That's not happening in Thailand. People in Thailand are quite compliant. What we have right now in Thailand is, and that is because of this basic compliance significant, that more and more people defy government orders. So there have been social media campaigns, for example, against the shutting down of restaurants. People simply defied that. Restaurant owners and people who were exercising solidarity with them. So this is, I think, a significant turn, that in the normal population, not in the politically active population, people defy government orders right now. What we also can see is a kind of trend of escapism. So many people on social media express their desire to leave the country simply. So there's a group on Facebook, Leave the Country, Leave Thailand. I don't recall the name exactly. And that group on Facebook had hundreds of thousands of members after a very, very short time. So this is the way how in Thailand people react. But the narrative, the COVID-19 narrative, if I would want to call it like that, is not really challenged. Not.
We have two questions concerning the economy. First question is, we already talked about the tourism sector and the collapse of the tourism sector. And you said a bit about the coping of the collapse with the tourism sector. So are there sustainable plans for the future except the sandbox model in Phuket? And actually, is the Thailand tourism sector prepared for forthcoming waves to come? So even maybe would be allowed to come to Thailand again if there's some sort of preparedness?
I think the government is prepared to redesign the tourism sector if everything is going back to some normality soon, only if then. So if the vaccination would be successful in the foreseeable future, what I'm a little bit skeptical about, then the sandbox system, the sandbox scheme is a very promising model that could be replicated in other parts of Thailand. And that would be, I think, very prudent measure to take. But it is only possible if the spread of the disease can be slowed down significantly. If it is going on like it is right now developing, this will not be possible, and even the sandbox system or scheme will be at risk then. And therefore, everything is dependent on the development of the third wave of the COVID-19 spread, with the Delta variant dominating. And in that, I would be skeptical. And therefore, I think the tourism sector is facing probably even harder times. I think this year will not be a good year for tourism in Thailand again at all. It will not become better in October. And that means devastation throughout the tourism sector. So we have already 2 million people jobless, and that will be way more. There will be hotels closing forever. That will also change, I think, the structure of tourism. So big hotel chains will take over a lot. So it looks not good at all.
Second question, again, concerning the economy. I mean, if you look at the pandemic, maybe one good, if you can say it, one good side of the pandemic is the speeding up of the digitalization in schools and in the work area as well. And so the question was, actually, do people try to move into other sectors, or do they try to return to their previous jobs? And of course, is there some effect of digitalization and a move towards digital remote work noticeable in Thailand?
Yes, Thailand is a country which is already quite digitalized. If I compare that with Germany, if I compare, for example, Thai universities with German universities, or also Thai courts of justice with German courts, Thailand is better. That surprised me when I came to Thailand. So the digitalization rate in Thailand is very high. The digital literacy of Thai people is very high. And indeed, this situation really provided a big boost for even more digitalization in Thailand. Internet is better in Thailand than in Germany too. So I think this is indeed one of the bright sides of this experience here.
There's one question which is concerning more a practical question. Hopefully you can answer it. It was said that Radio Thailand offers a German news program in the internet. And the question is actually, all the data published there, especially concerning COVID-19, are reliable?
I would say yes. The data are, I think the data in Germany are quite reliable. And that is a good question, because it is giving me the opportunity to say something about the reliability of data in general. Data are reliable only if you have testing, and if you have enough testing, and if you have accurate reporting. And I think this is very well done in Germany. So the data in Germany are accurate, they are reliable, and the German press is reliable too. Honestly, I don't know this media product, but I would trust the data that are disseminated in German media about COVID-19, absolutely, because the source is accurate, and there's not any tendency to distort that in the media. If this is really taken over then by a Thai outlet, I would trust it, yeah.
But the question was, I think, Henning, the question was that Radio Thailand offers a German news program. So from Thailand sent out to Germany, and if the data there are reliable, not on the German press, but on the Radio Thailand.
So I couldn't say anything about the reliability of the data in Thailand, with one exception. That thing was, I think, not so successful. And with that, I would be careful with the data in Thailand. I think the numbers of cases confirmed daily are not really matching the reality remotely even. You have right now reports of people dying at home and not even having been tested, dying because of COVID-19. So I think the data or the numbers are way lower than they actually are. What is not any expression of mean intent or anything. It's just related to testing.
Maybe another field of perspective which we did not cover yet is the field of religion. Looking at the Buddhist community, and here especially the monasteries, who are depending on alms. Actually, how does the pandemic affect the situation of the monks and their possibility to, of course, to finance themselves, and on the other hand, on their social services they give to the public?
Yeah, that is a very important point too. In Thailand, social services have been somehow always distributed by both the state and also the monasteries. Monasteries are still very important in providing these kind of essential services to the population. In the COVID-19 situation, monasteries suffered as much as households. They are dependent on donations. The donations are not flowing as much as they did before. And as much as the monasteries struggle to provide help, to provide services, as much they are also the victims of the crisis. And the question is indeed in the future for Thailand to ask, is the social security system in Thailand sufficient? Given that Thailand has, I think, the third fastest aging society, I think there again we can take the COVID-19 situation as a reason to reflect on structural developments in the country. And the social security system would be, I think, one of the points which would be very good to thoroughly think about in the future.
I think you already mentioned when you look now at the future, the three, there's a phrase called building back better. So actually to use a pandemic as a major incentive to not make the same mistakes like probably we did before, about building back better now. Not just building back, but we do it now better. What are the concepts in Thailand, and what are the main fields actually that Thailand has to build back better after the pandemic, or right now to react on the pandemic?
One argument I think would be interesting to ponder is not to focus on fancy, very advanced sectoral industries to build them better. For sure, that should be done too. But I would probably characterize the fundamentals of the social security system first. I think this is really the most pressuring issue for Thailand. If you see the numbers of people depending on the government and depending on other people to support them, this is a time bomb for Thailand. And this would be my first priority in building back better, or in drawing consequences, conclusions from this experience. Beside that, the government will surely try to expand its Industry 4.0 program, but compared to the social security question, I think this is way more important for Thailand.
Okay. So time is running up. First, we hope that the situation in Thailand will be on a better way soon, and that there is a reopening of sectors which are now closed. And with this said, we have to wind up the seminar. Well, thanks to Henning Glaser, the team behind the scene, and of course to all the participants who raised questions or who listened. As I said, the seminar was recorded. You can find it already on our Facebook page if you want maybe to re-listen to some aspects Mr. Glaser was saying. And of course, if you have questions, don't hesitate to contact us on asia@hss.de. You may subscribe to our newsletter as well to stay informed about our activities in the countries mentioned, about media platforms like Facebook and Twitter. The next seminar will be on the 21st of July, where we will discuss the situation in South Korea. And when you sign out now, you will see a short survey. Please take the minute it needs to fill it out so that we can improve our online seminars in the future. Of course, when we talk about COVID-19, please stay healthy and see you soon to the next seminar.